Number 7 counts and records radial pulse. 1. Explains procedure for test purposes, speaking clearly, slowly, and directly, maintaining face-to-face contact whenever possible. 2. Count respirations for 1 full minute. 3. Place signaling device within reach. 4. Wash hands. 5. Record respiration rate within plus or minus 2 breaths of evaluator's reading. Number 10 feeding a client who cannot feed self. 1. Explains procedure to client, speaking clearly, slowly, and directly, maintaining face-to-face contact whenever possible. 2. Before feeding, looks at name card on tray and asks client to state name. 3. Before feeding client is in an upright sitting position, 75 to 90 degrees. 4. Places tray where the food can be easily seen by client. 5. Candidate cleans client's hands with hand wipe before beginning feeding. 6. Candidate sits facing client during feeding. 7. Tells client what foods are on tray and asks what client would like to eat first. 8. Using spoon, offers client 1 bite of each type of food on tray, telling client the content of each spoonful. 9. Offers beverage at least once during meal. 10. Candidate asks client if they are ready for next bite of food or sip of beverage. 11. At end of meal, candidate cleans client's mouth and hands with wipes. 12. Removes food tray and places tray in designated dirty supply area. 13. Signaling devices within client's reach. 14. After completing skill, washes hands. Number 16 performs modified passive range of motion (PROM) for one shoulder. 1. Explains procedure to client, speaking clearly, slowly, and directly, maintaining face-to-face contact whenever possible. 2. Privacy is provided with a curtain, screen, or door. 3. Instruct client to inform candidate if pain experienced during exercise. 4. Support client's upper and lower arm while performing range of motion for shoulder. 5. Raise client straightened arm from side position upward toward head to ear level and return arm down to side of body, flex ion extension at least 3 times unless pain is verbalized. Supporting the limb, move joint gently, slowly, and smoothly through the range of motion, discontinuing exercise if client verbalizes pain. 6. Move client straightened arm away from the side of body to shoulder level and return to side of body, abduction abduction, at least 3 times unless pain is verbalized. Supporting the limb, move joints gently, slowly, and smoothly through the range of motion, discontinuing exercise if client verbalizes pain. 7. Signaling devices within reach and bed is in low position. 8. After completing skill, wash hands. 17 position on side. 1. Explains procedure for test purposes, speaking clearly, slowly, and directly, maintaining face-to-face contact whenever possible. 2. Privacy is provided with a curtain, screen, or door. 3. Before turning lowers head of the bed. 4. Raises side rail on side to which body will be turned. 5. Slowly roll onto as 1 unit toward raise side rail. 6. Places or adjust pillow under head for support. 7. Candidate position client so that client is not lying on arm. 8. Supports top arm with supportive device. 9. Places supportive device behind and back. 10. Places supportive device between legs with top knee flexed knee and ankle supported. 11. Signaling devices within client's reach and bed is in low position. 12. After completing skill, washes hands. Number 19 provides foot care on 1 foot. 1. Explains procedure to client, speaking clearly, slowly, and directly, maintaining face-to-face contact whenever possible. 2. Privacy is provided with a curtain, screen, or door. 3. Before washing, check water temperature for safety and comfort and ask client to verify comfort of water. 4. Basin is in comfortable position for client and on protective barrier. 5. Put on clean gloves before washing foot. 6. Client's bare foot is placed into the water. 7. Apply soap to wet washcloth. 8. Lift foot from water and wash foot, including between the toes. 9. Foot is rinsed, including between the toes. 10. Dry foot, including between the toes. 11. Apply lotion to top and bottom of foot, remove excess, if any, with a towel. 12. Support foot and ankle during procedure. 13. Empty, rinse, and dry basin. 14. After rinsing and drying basin, place basin in designated dirty supply area. 15. Dispose of used linen into soiled linen container. 16. After cleaning foot and equipment, and disposing of used linen, remove and dispose of gloves, without contaminating self, into waste container and wash hands. 17. Signaling devices within reach. Number 21 perineal care for female. 1. Explains procedure, speaking clearly, slowly, and directly, maintaining face-to-face contact whenever possible. 2. Privacy is provided with a curtain, screen, or door. 3. Before washing, checks water temperature for safety and comfort and asks client to verify comfort of water. 4. Puts on clean gloves before washing perineal area. 5. Places pad linen protector under perineal area before washing. 6. Exposes perineal area while avoiding overexposure of client. 7. Applies soap to wet washcloth. 8. Washes genital area, moving from front to back, while using a clean area of the washcloth for each stroke. 9. Using clean washcloth, rinses soap from genital area, moving from front to back, while using a clean area of the washcloth for each stroke. 10. Dries genital area moving from front to back with towel. 11. After washing genital area, turns to side, then washes and rinses rectal area moving from front to back using a clean area of washcloth for each stroke. Dries with towel. 12. Repositions client. 13. Empties, rinses, and dries basin. 14. After rinsing and drying basin, places basin in designated dirty supply area. 15. Disposes of used linen into soiled linen container and disposes of linen protector appropriately. 16. Avoids contact between candidate clothing and used linen. 17. After disposing of used linen and placing used equipment in designated dirty supply area, removes and disposes of gloves without contaminating self into waste container and washes hands. 18. Signaling devices within reach and bed is in low position.